Hi, good afternoon. My name is Tricia, and I am a family development specialist with Catholic Charities of Kansas City, St. Joseph. And I wanted to jump on here today to do a quick presentation on preconception health. And I really wanted to focus on what does it even mean? What does preconception health mean? Who can benefit from it? What does it even look like? What steps can I take? What's involved in preconception health? So those are the things that we're going to touch upon today in the presentation. So hopefully you will all leave the presentation with gleaning some piece of information from it that can be useful for you, or even for you to share with somebody in your world. So let's get started on preconception health. I had this wonderful PowerPoint presentation all put together to share with you all, and I can't get this platform to share my PowerPoint with you. It's worked in the past. I don't know what's going on today, but all I know is that life has thrown me lemons, and I'm going to make lemonade out of this. So let's make lemonade together. I apologize that you were going to have to sit through this presentation looking at me and just listening to me talk. It's certainly not the way I had hoped this would roll out, but this is what's happened. This is the reality, and we're going to make it work. So with that being said, before I can get into the meat of the presentation, there is a disclaimer that I need to put out there. I had a nice slide typed up with all these words on it, and I'm going to have to read it to you word for word now. So let's go ahead and do the housekeeping. Let's get this disclaimer read through, and then we can jump right on into preconception health. Okay? So let me pull it up on my end so I can read it to you. Okay. So Catholic Charities is not a medical provider giving medical advice specific to your personal situation or otherwise. For this presentation, we collected information from governmental or official sources, primarily Centers for Disease Control. We have not independently verified and cannot guarantee the accuracy of the information. COVID and vaccine information is continually changing. This information was prepared in March of 2021. We want to provide this information to you quickly. It could contain inaccuracies. So now that we've got that piece of it read and out of the way, let's just jump right into preconception care and what it looks like, and let's just go. Cool. Okay, so preconception health, what is it? What are you talking about, Trish, when you talk about preconception health? Well, it refers to the health of both women and men during their reproductive years, and it focuses on taking steps now to protect the health of a baby that you may have in the future. And so part of preconception health is about getting healthy and staying healthy. So with the focus on taking charge of your personal health, all women and men can benefit whether or not they plan to have a baby one day. So while I was reading through information on preconception health, I ran across a statement that on the CDC website that half of all pregnancies in the United States are unplanned. So that just kind of drives home how important it is, the concept of preconception health. It drives home how important that is for each one of us to get healthy and stay healthy, to increase the chances of having healthy pregnancies, healthy babies, and healthy families in the future. So, and even if this is information that you don't think is useful to you today, maybe there's somebody in your world you can share it with. Share that information. We're all part of this big thing together. So let's move forward and just kind of planning for pregnancy. What does this look like? What does my healthcare plan kind of look like if I'm just thinking about getting pregnant? So let's talk about healthy women and what does that mean in terms of preconception health? So for women, it's it's not just for those who are planning to become pregnant. It's really is about making healthy habits, choosing healthy habits, and just taking control of your life. And it means living well, feeling good about where you're at in life. And preconception health really is about making a plan for the future and then taking those small steps and working towards those small steps to get you towards the end game. But men are not left out of this either. Healthy men are equally as important to preconception health. So what does it mean for men to be healthy in terms of preconception health? Well, it means that they are choosing to get and stay healthy as possible. And as a partner, it means that you're encouraging and supportive of your partner and her health. And as a father, it means that you are protecting your children and that you are providing yourself and your loved ones with the best, brightest future that you can. So, what do we do? What are some steps that we need to take in terms of preconception care? So, the healthcare aspect of this is really just the medical care that a man or a woman receives from a doctor or other healthcare professionals that's really going to focus on the parts of your health that have been shown to increase the chance of having a healthy baby. So, with that being said, it's important to remember that this is not a cookie cutter process. We are all unique and we all have different needs. And so it's really important to have this conversation with your doctor ahead of time, just to let them know, hey, I'm thinking that I eventually want to have children. I eventually want to start a family, or I want to have more children, and I want to be as healthy as possible, and I want my babies to be as healthy as possible. So you can work with your healthcare provider on developing a plan for treatment or an action plan and those steps that you need to take to get you to where you're feeling good and you're feeling healthy. So there are some things that the literature tells us that we should do, and they suggest that we should do in working in conjunction with our healthcare provider. And one of those things is to discuss with your healthcare provider any medical conditions that you may have. Now, you may have had a prior pregnancy and there may have been an underlying medical condition or a health condition. And by talking to your doctor ahead of time, they can, if they need to run additional tests or if they need to do like blood work or anything like that, it gives them time to work with you on finding that root cause of that underlying health condition and then to provide treatment for it. So it can just lower your chances of having the same complication or the same health condition in your next pregnancy. The other thing too is that it gives you and your healthcare provider the time and the opportunity to treat current health conditions. And I'm talking like, it could be like diabetes or high blood pressure. So it gives you all some time to treat those, to get the treatment that you need before you're pregnant. And it just is going to improve your chances of having a healthy pregnancy and a healthy baby. So talk to your doctor about any medical conditions that you currently have or you have experienced in past pregnancies. While you're talking to your doctor, it's also so vitally important to talk to them about what medications you are currently prescribed. And I know sometimes it seems like we can be seeing maybe a couple different specialists or a couple different doctors in different specialty areas. And it is so extremely important that we are all singing from the same page. So make sure that every provider, everybody on your healthcare team is aware of what prescriptions you've been prescribed and are taking, so that everybody can move together as a team in your best interest. Doctors just really do. They want you to be healthy. They want your baby to be healthy. And so it's really important to make sure we're all singing from the same page, right? And so it's a reminder that we should be taking our medications exactly as they're prescribed to us, and we should not be taking somebody else's prescription medications. So again, literature tells us that's another piece of that conversation that we need to be having with our healthcare provider, and it's a very important part of our preconception health. The other thing too is to have a conversation with, it's suggested we have this conversation about our lifestyle choices or behaviors. And by this, for this presentation, I am referring to substance use issues. So if you're experiencing any addiction issues, and I'm referring to like alcohol, opioids, illegal street drugs, or even smoking, whether it's cigarettes or e-cigarettes, that's what I lump into substance use. And so if you are experiencing any addiction issues with those substances, it's never too late to quit. It's never too late to quit. And so I tell families that if you're smoking, baby's smoking, and that includes secondhand smoke too. So if you're inhaling secondhand smoke, baby's inhaling it too. If you're drinking alcohol or using drugs, the baby's using also. And so the use of these substances can make it harder to get pregnant, and they are also harmful to baby once you're pregnant. So again, never too late to quit. Now, I will acknowledge that those are tough conversations to have. But they are so extremely important and vital that we have that conversation with our healthcare provider. They need to know what's being put into the body so that they can make good treatment plan with you and make the best healthcare decisions moving forward. So as difficult as it may be, it's a very important conversation to have with your healthcare provider. Okay. So the next thing that it is encouraged that we talk to our doctors about is folic acid. Now, folic acid is a B vitamin, that every cell in our body needs, and it promotes healthy growth and healthy development. So taking it before and during the early part of pregnancy, and by early part of pregnancy, the CDC is saying up to 12 weeks, it can help prevent birth defects of the brain and spine. So, and birth defects can cause overall problems in overall health and development for babies. And so it's important to get the recommended amount of folic acid on a daily basis. So again, that should be a part of the conversation that we're having with our healthcare providers so that we know exactly how much folic acid is recommended to us that we should be taking to get our bodies healthy and to prepare us for having a healthy pregnancy. So folic acid can come in a few different forms. It can be in a multivitamin. So, you know, a multivitamin's a pill and it's got vitamins and other nutrients that keeps our body healthy. So you can get folic acid in multivitamins. There's also prenatal vitamins, excuse me. And those are available either by prescription or over the counter without a prescription. So again, conversation to have with your doctor about the folic acid and what's the best way to get it. You can also get supplements that just contain folic acid, as well as you can get folic acid through foods like green leafy vegetables and broccoli and Brussels sprouts. And there are cereals that are fortified. So if you eat fortified cereal, you're getting some folic acid. But again, that should be a piece of the conversation with your healthcare provider. The folic acid, like, should I be taking it and how much should I be taking and what form should I be taking it in? So add that to the list of things that we should talk to our healthcare provider, and it's all part of preconception health. Toxic substances are another area to look at. So if you use like chemicals or cleaning supplies or chemical solutions or whatever at work, that's a great conversation to have with your healthcare provider about, or even at home, like the chemicals that you're using to clean your home. You know, have that conversation and find out, are these chemicals, are they unsafe for me? Are they unsafe for my baby? What could they be doing to my body? So definitely have that conversation. Talk about what chemicals you're using or you have around the house or at work, and see if they are harmful to you or baby. Now, I talked about some preconception health to a family not too long ago. And when we hit the toxic substances conversation, of course, we went to chemicals, but then we also went to toxoplasmosis. And she had never heard of toxoplasmosis. So we had a fun conversation. Well, it's not fun, but we had a spirited conversation about it. And she learned, she'd never heard of it. She learned something new. And that's what this is about. It's about learning some new information, and sharing it with others. And the education is key. So toxoplasmosis is an infection that you can get from eating undercooked meat or from touching solid cat waste. So, yes, you heard me correctly. So, if you're pregnant, to help reduce that risk of toxoplasmosis, the professionals suggest that if you are the one who has been cleaning the litter box, that somebody else needs to step up and clean that litter box for you while you're pregnant. I know it is so not a glamorous job. Nobody's probably going to just be jumping out of their chair to clean the litter box every day, but it is so important that pregnant women have somebody there to do that task for them to help reduce your risk of toxoplasmosis. And of course, cooking meat thoroughly and not eating undercooked meat will also help too. They also suggest, the literature also suggests that if you have rodents like guinea pigs or gerbils, hamsters, mice, that somebody else provide the care for those pets while you're pregnant. So just be really mindful of not only the chemicals and the cleaning supplies and things like that that may be used in the house or at work, but also pets, if pets are going to pose a concern for you in having a healthy pregnancy. So let's add toxic substances to the list of things to talk to our healthcare provider about. Okay, healthy weight. It's great to have a conversation about what's an ideal weight for me. It's going to look different for all of us. But being overweight and being underweight can pose some problems during pregnancy. So one of those problems could be premature birth, and that is birth of the baby prior to 37 weeks of pregnancy. And so babies who are born prematurely may have health problems at birth and then later in life than babies who are not born prematurely. So by being mindful that body weight is part of preconception health and could play a role in how healthy our pregnancy is, and it's good to get started. If to get to that ideal weight that your doctor, your healthcare provider thinks that would be a good weight for you to just help reduce your risk. And being overweight and underweight, one of the other problems that it can create for women is birth defects for the baby. So, and again, those are the health conditions that are present at birth, and they cause problems in the baby's overall health and development. So just be mindful of that, and we will add healthy weight to our checklist of things that we should talk to our doctor about when we're contemplating having a baby in the future. The other thing that has been recommended to do is to start making note of family history of any health conditions, whether it's you, your partner, each of your families. Just jot down health conditions that have been present in the family, treatments that people may have received. It just really helps give your healthcare provider a bigger picture of maybe some genetic things that could be present, because there are certain health conditions that do run in families or in specific ethnic groups. So again, just making note of those things and just keeping that handy. It's good information to share with your healthcare provider. And then the last thing that is recommended as part of preconception care is to take care of our mental health. I could go on the rest of the night about the importance of mental health and taking care of ourselves. And but that's a topic for another day, right? But mental health is so important. It's so vital. It's so vital. So they touched upon reducing stress levels. So part of preconception care and preconception health is about reducing your stress levels. High levels of stress can cause problems during pregnancy. So finding ways to manage that stress and developing the tools and the skills you need to manage that stress effectively prior to becoming pregnant is beneficial for you. And so, whether that means that, not everybody's all for counseling, but there are counselors out there, there are people out there who are trained, who are willing to walk beside you and be a support and help you develop that toolbox and that skill set. And so, but I get that that's just not for everybody. And I think over the past year, we've really seen a rise in virtual therapy or virtual counseling like this. And so I think that may, in some regards, and I heard this morning and never had thought about it. I think in some regards that helps some people, like they don't have to, there's not that fear and that anxiety about going somewhere and sitting in a waiting room and going through that whole process. I mean, you're in the comfort of your home, you're in your safe place, or you're you're in your car. It's just wherever you feel safe, wherever you feel comfortable. And it's kind of nice. Like I said, I hadn't thought about it in that regards. It's kind of, you get to figure out where you're going to feel the most comfortable at in your environment as opposed to traveling somewhere. But again, I understand counseling's not for everybody, but please know that there are those resources out there, and there's people who are trained and willing to help, not only help you with stress levels, but also with any other mental health issues or symptoms that you may be experiencing. They also suggest being active, making healthy eating choices, getting plenty of sleep. And then also, if you are in an unsafe situation, strongly encourage to seek help, get to a safe situation. For women who are in domestic violence situation or intimate partner violence situations, and it has been shown that the risk of pregnancy or abuse during pregnancy sometimes gets worse. So it's so important that you take care of yourself. Okay. So why is all of this important? Why do I need to focus on this preconception care, Trish? What's this why? Why? Well, preconception health, and let me pull up my slide because I had some wonderful words here. So despite advances in medicine and prenatal care, birth outcomes in the United States are actually a bit worse than many other developed countries. So with that information, it's just taking care of yourself and taking care of your health and taking charge of your health and getting healthy and staying healthy. It just gives babies the best chance for a healthy start in life. And honestly, that's the best gift you can give to your baby. It's also a great way to create a healthy family. So the health of your family relies on each individual person in the family. So when each person's healthy, the family's healthy. So it really is just a great way. Preconception health, like I said, if it's not something you're planning on in the near future, it might be distant a few years down the road, but it's still really important now. Start working on your health, start getting healthy. We all know that doesn't happen overnight. I mean, realistically, it just doesn't. And so it takes some time to develop healthy habits, and that's what I'm getting at. So it's never too late to start working towards getting healthy and staying healthy for preconception care. So I do have some resources on another slide that I really wanted to give to you in regards to mental health, and substance use. And I'm going to read those to you right now. You can jot them down if you feel so inclined. I hate that I don't have the slide to put this up, but if you're interested in quitting smoking, you can call 1-800-784-8669. And that is 1-800-QUIT-NOW. And that is for smoking cessation. So you'll get connected to a real life human being, and they can help be a support, provide resources, and help you develop a plan to stop smoking. There's also the Substance Abuse and Mental Health Services line. That's 1-800-662-4357. It's confidential. It's answered 24/7, and they can get you linked to resources for substance abuse and mental health services. And then there's the Domestic Violence Hotline. Again, completely confidential, answered 24/7. It's 1-800-799-7233. There is also a website called findtreatment.gov, G-O-V as in Victor. You plug in your zip code and it can pull up local treatment facilities in the area if you feel like that is what is really needed. And then there's also aa.org, O-R-G. And if you're interested in local Alcoholics Anonymous meetings or resources, again, just go to that website, plug in the zip code, and it'll pull up local meetings and resources for you. So that was a lot, but I appreciate if you've made it to the end, you hung in there. We made lemonade together, and I thank you so much for hanging out with me today. Just remember, preconception health is good for all of us. It's all about taking those small steps to get healthy, to stay healthy, and it really ultimately improves our chances of having a healthy pregnancy, which means healthy baby, which equals healthy family. And we're all about healthy families and healthy babies. So take care, and I'll see you in the next time. Take care. Bye-bye.